I'm Edel, I'm coming from Germany, and I'm a midwife and a midwifery tutor and having a lot of experience for more than 40 years. I've been working in my profession as well as a teacher, as well as a midwife. Now I've been invited by CCI, and this is the reason why I'm here, because I like to teach people who are interested in different spheres of the health. Today's topic is speaking about examination of a newborn baby. You see, this is a newborn, and I'm going to show you how to examine this baby from head to toe. And I first like to introduce you to the material or to the equipment that is necessary. It is very good when you have something like a stethoscope in order to listen to the fetal heartbeat and also to the breathing. And then, of course, you need to have gloves. You should have also a kidney dish for throw away things. You have a little prep, and you have some cotton wool in case there happens an accident to the baby. And then, of course, first of all, you take your watch off, because this is a collector of germs, otherwise, if you wear it. So now I can start, and I start with washing my hands, that I have done already, and now taking on my gloves. Okay, now let's start. We look at our baby, and of course it has to be uncovered, undressed, because otherwise we cannot really see what the matter is. And when we start, we take off all that is on the baby, all clothes. So finally, the baby is laying naked in front of us. And now we start to investigate the baby or to examine from head to toe. So that should be in a certain sequence, because if you do sometimes here, sometimes there, you forget at the end what you wanted to find out. We start at the baby's head. And so we first look at it, and then we look at the sutures of the skull, and we look also on the fontanelles. Here in front we have the great fontanelle, and there we have the small one. The little fontanelle in the back, on the back head, is something that is going to be closed about at 6 weeks. And so far everything is fine. I cannot feel anything that is strange here. Then I look at the baby's face, how it looks like. This is not bruised, because this can happen during a delivery, but this is fine. I look if 2 eyes are there. Yes, this is okay. And the other one as well. And this is very important that you look, because the baby, most of the babies have their eyes closed. And then you cannot see if the eye is really there, or if there was some damage. Next, you look to the nose, and this has also 2 pits, it's fine. And you look to the mouth, and you don't only look, you put also your small finger in. Therefore, it is necessary that you wear gloves, because you never know if the mother maybe has been suffering from HIV or so, and you can infect yourself in case you don't wear gloves. So you take your little finger, and you support the baby's head, and then you go along the gums and the soft gums. And this is okay. Everything is closed, because you can have some deformations in that place, and this is important to know. So cleft palate or something, we call that. But otherwise, the mouth is fine. Then we look at the ears. So we bend the baby a little bit to aside. And yes, this is fine. Here's even the duct going into the ear, this is fine. And on the other side, yes, also this is well developed. And we try to take the ear, the outer ear, and to clap it in front in order to see how mature the baby is. Because when you clap it in front and it keeps standing in front, then it means the baby is premature. But this baby is all right, so we have nothing to complain about. And now we have seen with the ear everything is fine. The next thing we are looking is the cervix. And this is everything fine here. The baby can move the head from one side to another. Yes, well done, dear. You did it. Okay, and then we go on and look at the arms. So we look if we can bend them, yes, and stretch them. This is fine, okay. We count on each hand the fingers, the number of fingers. This is 1, 2, 3, 4, 5. And we also separate them because in some disturbances it happens that the fingers are grown together. But this one is fine. And we look at the other. 1, 2, 3, 4, 5. Yes. And we also separate them. And then we put our thumb into the inner surface of the hand. And normally there is a reflex of the baby coming up. This is a crisping or grasping reflex, so it closes the hand, and it does, as you can see it here very nicely. So on the other hand, not yet, but it will happen. And when this grasping reflex is working, you can put the baby slowly take away from the surface it was laying on, and the baby's body follows you. This is a normal reaction. So therefore, that baby is so far all right. Now, you go on and you don't forget to protect the head in between, because the head has the biggest surface, and when it is a lot outside some material, then it will cool and the baby loses warmth. And this is very important that this does not happen, because if it happens, then it can develop a sort of trouble with the circulation of the baby. Therefore, you need to protect the warmth. Now we look further and we look at the chest now. And for that reason, I brought with me my stethoscope and I put it on the sternum and I listen to the fetal heartbeat and I count it for 1 minute. Okay. This baby has a heartbeat of 100 beats per minute, and this is all right. Don't do the mistake and count only up to 15 or to 20 and then take it 4 times, because you will not hear if there are any irregularities or arrhythmias. The second reason why you use a stethoscope is to listen to the breathing. And this I'm also going to do. And again, I use my watch and count for 1/4 of a minute. Okay, this baby breathes in 1/4 of a minute only 5 times, and this is for a newborn baby too less, because if you take 5 times 4, then you are at 20 breaths per minute, and a newborn baby should have about 35 to 40 breaths at a minute. So therefore, I have to look, is there something wrong with the baby? Why is it so slow in breathing? So now I go on with my investigation. I have not yet found out the cause why it is breathing so slowly. But one could be also that it is too cold for him. So therefore, I have to cover whatever is possible. Next thing, I look at the abdomen or at the belly of the baby. And there I palpate with 2 fingers in order to see if that is soft. Because when I find something else, not soft, but strong, then it means there's something wrong. Normally, the baby's belly is soft. And here is everything fine. And I look, of course, at the umbilicus. And this baby is now 4 days old. Therefore, the umbilicus has already gone off, the rest of the umbilical cord. And the umbilicus itself looks nice. So this is nothing wrong with, but I go with one of the small swabs and go over and clean it a little bit. So I don't have anything else to do, because I can advise the mom to put some drops of her breast milk in, because that heals very, very nicely. So, and she can give the baby a bath, it's no problem at all. So then I go further down and I'm in the Canal, this is here. So, and I also put my fingers in and palpate, and here's everything fine. And then I look at the outer genitals, and this is a little girl. And I look and I see two labia majora and the corpus, the labia minora, which is very good because it shows this is a mature baby. And I see also that the fine girl. Good. So then we go on and look at the baby's legs. And here again we try to move the legs, to separate them, and also to move them in order to see if the hip joints are healthy. This is the case. And then I also try to bend the leg a little bit. Yes, this is also functioning, and to stretch it. Yes. And then I look at the leg, at the feet, and at one foot, one after another, and I do the same as I did on the hand. So I count the toes. 1, 2, 3, 4, 5, and I separate them also. Yes, this is very nice. And then I look at the surface of the sole, and I can see that there are some sort of like wrinkles, and this is very, very good because it is also a sign for the maturity of the baby. So this baby is completely all right. And I do I continue with the other leg in the same way. 1, 2, 3, 4, 5. Yeah, fine. Okay. And then when I'm on the leg, I can also try for check one reflex, and this is called the plantar reflex. So I go along the outer side of the foot sole, and the baby separates the toes, which does it very nicely. And the other one also. Yes, well done, girl. You're great. And now I take the girl and support also a little bit the neck, and put it straight in order to put the baby's foot on the surface. And then I can see this is a check for another reflex of the newborn. When I put one leg on a straight, flat surface, then the other leg will be lifted up. And then I do it with the other side. Yes, you do it very well. So it looks as if the baby is going to have a walk. So, well done, girl. You are very brave. And you don't cry. Thank you so much. So, and now we turn the baby from the front to the back. Meaning like this. Okay. And again, we look on the back side of the baby, because this is very important. The first thing was the baby, it will not stay like this. It will turn its head when it is healthy, and this is okay. And the baby tries even to lift up the head, which is also all right. And then you look at the spinal column of the backbone, because if the baby would have a problem, then you could find maybe a small hole. You can almost not find the entrance of that. But this is very dangerous and could be the start of an infection. So this baby has to be seen by a pediatric surgeon, because it must be operated. But this one is all right. Everything is fine here. So, and then you look, of course, on the anus if that is patent, because in some babies it is not, and then they also need an operation. Oh dear, excuse me, I forgot to turn your head. So now, yes, this one is also fine, and you can, of course, you don't have to put anything in the anus, because most of the babies have already let out a poo, and when a poo goes through, it must be open, otherwise it doesn't function. So there is one more reflex I like to show you, but otherwise with that baby everything is fine. I turn it back. So, baby, fantastic. The only thing I have discovered so far is that the breathing is not all right, but every other thing is fine. Now I will not completely cover it, because I like to show you one more reflex that is important. So you take the baby under the head and support the backbone. So, and then you leave the baby downwards towards your surface. So, and it will take up both hands, but I have only, you see here only one. Yeah. And this is a reflex that is very important. And when the hands or the arms are up, then it will, afterwards, it will close the arms over the chest. because it is a sort of protectional reflex. You could also do it in another way if you don't like it like this. If you do it in front of a mother or the parents, you should inform them, because they might be afraid that you let the baby fall. Yeah? So you tell them beforehand, now I'm doing a test and don't be afraid, I'll be careful. And the other thing you could check for the reflex is, for the same reflex, is that you leave the baby there, laying down on the surface, and then you tell the parents again, warn them that you clap with your hand on the surface. So, and the baby's arm will go up, arms will go up, yeah? Because if you don't tell them, you clap at the surface and they think you will beat your baby. Yeah? Therefore, warn them, please. Now, baby, I'm very happy with you. What do we about your breathing? Huh? Tell me. I think maybe you need some warmth. So I give you to the mom, and she may take you to her skin, so that you can gain warmth, and then I think your breathing will come up. Okay, well done.